Okay, thank you and good afternoon, everybody. Thanks for joining us. I hope everyone had a nice weekend. Seemed like a nice weekend to lay around the house with all the rain going on. So before we get started, I want to give you some updates on how the task force is going to keep you informed going forward. So we're going to continue doing these briefings via Facebook Live. However, we're going to be scaling them back to only one day a week. And generally, those briefings will be on Monday afternoons. Next Monday is Memorial Day, so we'll plan on doing it on Tuesday of that week. Now, we'll also continue to provide the daily updates to the media in writing, and I think those updates are helpful, and they really show the COVID-19 trends in the region for our hospital data, and we'll continue to share those every day. So, as everybody knows, today has been the first day of our gradual reopening in the city of St. Louis and St. Louis County. The relaxing of social distancing orders is an important time and a sign of progress this region has made in stopping the spread of the virus. The work done so far by everyone in the region has been really remarkable, and it's allowed us to get to this moment where we are today. And all of us are really glad to see the beginning of a gradual and responsible reopening of our economy. But it's also important for us all to remember that the virus hasn't left, that it hasn't changed, it's still here. It's still very contagious, and it's still dangerous. And if we let our guard down or act like the virus is gone, it will very likely hit the people in the region very hard with a second wave. And so that's not something that we want to do. None of us wants to see a second wave of the virus that could have an impact not just on our economy, but on our people as well. So because of the relaxing of shelter-in-place orders, it's more important than ever that we do all of those things that we've continued to preach here to keep us safe. We need to keep social distancing, hand washing, wearing face masks in public, and using all of those other evidence-based measures that we can to keep our rate of transmission low. Now, as I mentioned before, our region has made some really significant sacrifices over the past 2 months to flatten the curve and significantly suppress the virus. However, we also know that we're never going to be at zero transmission until there's a vaccine. And so we have to learn how to live with the virus and take all those important steps to keep it in check. We can gradually reopen the economy and do it in a way that continues to use what we've learned so far, but only if we learn how to dance with the virus. So let me share our current updates, and then I'll be happy to take questions from the news media. So we'll go ahead and get started with our hospital admissions rolling average. So here's the chart showing our hospital admissions. And it continues to show progress. Again, it shows the trend in the daily new hospital admissions since early April. The rolling average still shows a steady decline since early April. And remember, these data reported on the chart are lagged about 2 days behind, so that what you see now is what we logged on Saturday, where we admitted 32 new patients. And the 7-day moving average stayed the same at 487. So this continues an important trend and is an indicator of the level of suppression of the virus in our community, and we want to continue to see it come down and stay low as we reopen. Again, we don't put too much stock into day-to-day fluctuations. It's more important for us to look at those trends, and those trends are staying steady. So next we'll look at our hospital admissions. So our hospital numbers continue to maintain our progress as well. And this is our daily hospital census of COVID positive and suspected COVID patients, as well as the rolling average, which is presented with the blue line that you see there. Today's rolling average is 487, and it's leveling off. However, it continues to be as low as it's been since we began tracking this data in early April. Today's overall hospital census increase, today it's at 487, which is up from 467 yesterday. Ideally, we want to see these trends continue downward, and we want them to stay as low as possible. Now, moving on to today's numbers, let me update you on our daily hospitalization numbers. So as I mentioned, we have 487 hospitalizations today of confirmed COVID and suspected COVID patients, which is up from 467 yesterday. We have 109 confirmed COVID and suspected COVID patients in the ICU, down from 121 yesterday. And we have 76 confirmed COVID and suspected COVID patients on ventilators, which is up slightly from 75 yesterday. And then, of course, our good news slide, our task force healthcare systems discharged 12 additional COVID patients, bringing our cumulative total to 1,892 since we first confirmed a COVID patient in this region. So again, thank you all to the healthcare workers who have helped these patients get better and be able to return home. So with all that being said, again, as we begin relaxing our stay-at-home orders, here's what you can do to keep yourself and your family safe, and frankly, allow the St. Louis region to get the economy back on the right track. Now, these are proven practices that help lower the transmission rate and the reproductive factor of the virus and keep it low within our community. And so these are reasons why we're feeling optimistic if everybody can follow these proven practices. So as you can see there, maintaining social distancing of 6 feet from others, apart from people that you live with, obviously. Wearing a face mask in public is very important. I can tell you I was out picking up food over the weekend at a restaurant, and most people were wearing masks. There still were some that were not. So please, for the community, wear those masks. Wash your hands frequently with soap and water, at least 20 seconds, multiple times a day. Clean surfaces regularly, including phones, doorknobs, counters, and light switches, all those things that people touch really frequently. Make sure you monitor for signs of illness and contact your doctor if you're experiencing symptoms. Don't gather with more than 10 people. Stay at home if you're vulnerable or at high risk. So if you have other conditions that put you at high risk for infection. And do not visit nursing homes or assisted living facilities at this time. Now remember, both the City of St. Louis and St. Louis County have detailed guidance for people and businesses, and I encourage you to take time to read all of those and put them into practice. There's some very good documents out there. These are the steps we all need to make to keep the transmission rate low and to prevent a new surge of cases. So please take care of yourself and your family and the entire community. So the progress in this region has been really incredible, and keeping the right measures in place will help us prevent spread while we gradually begin to reopen our economy. We'll keep a close eye on the data as we make decisions during this next phase. And now we'd be happy to answer any questions from the media.
How many cases of the pediatric inflammatory syndrome, which has been connected with Kawasaki disease, are there in St. Louis regional hospitals? And given that many child care centers are opening up today, is there a possibility of seeing more cases of that syndrome? And how are hospitals preparing to deal with that?
So in talking with the children's hospitals in St. Louis, so St. Louis Children's Hospital and Cardinal Glennon Children's Hospital, they believe they have about 3 or 4 cases right now that fit the syndrome. So it's the new case definition for the multi-inflammatory syndrome in children. But they're still working to collect more data on that. With the reopening of childcare, of course, there's always a risk of more transmission, not just of COVID, but of any virus or bacteria. And so that's why it's really important that if kids are feeling sick, that they need to stay at home for childcare to maintain all of the cleaning procedures and making sure plenty of hand sanitizer, soap and water, all of those things to keep any transmission as low as possible. Now, it's also possible that with increased transmission or increased risk of transmission that you might see more cases. But I do want to emphasize, though, that this condition is still extremely rare. If you think about all of the thousands of cases of COVID that we've seen, not just here, but across the country, there's still a relatively small percentage of children that have shown up with this syndrome. And they usually recover well. It's usually older kids. They can no doubt be extremely sick, but they usually recover well. And I will point out that we have not seen a pediatric death due to COVID in the state of Missouri. And so, you want to balance all of that concern with child care opening up with the understanding that it's still a rare condition.
As the economy opens up and people begin to exit stay-at-home orders, what mechanisms are in place beyond contact tracing to monitor the population for any spikes of COVID-19?
So we do that a couple of ways, and so a lot of it is the data that we present here. And so the one piece of data that we look quite frequently at is that admissions data. And the reason for that is if you think about the progression of the disease, so it's really difficult to understand when people are exposed or when they initially become infected. Then they'll become symptomatic, and then sometimes, not all the time, but sometimes people will seek out testing and healthcare. And so that's really when we can capture them at the earliest point is at that testing point. And so the testing, though, is very, so as you've heard me say, is somewhat sporadic in the community, and the times that the testing comes back is a little bit sporadic. And so it's not as timely, or it's not as robust as our hospital admission data. So we continue to look at our hospital admission data. We'll continue to look at our hospitalization data. But we're continually looking for other pieces of data that we can monitor to try and get as early signal as we can. We have a whole group of analysts and data folks that are looking at all of that right now. And we think we can come up with some better data sources or some better ways to look at the data. But those, the admissions data and the hospitalization data are two of our best data points right now.
Peru has reported success in monitoring population outbreaks by neighborhood by testing sewage and wastewater for the presence of the virus. Would this potentially be applicable in the St. Louis region?
It could. I'm not sure if it's ongoing right now. There are a number of cities in the United States, though, that have reported doing this. And so it's good for public health epidemiological data. It's not really good for narrowing down sources of infection. So if you think about it, it's sampling a large collection of the population to see how much virus is in the wastewater. And then if you sample it at regular intervals, then you can kind of understand where you are at any given point in time. So, the point being is if there are a lot of people that are shedding virus, then obviously that sample would contain much more virus, where if there was lower amounts, then it would be lower. So it's actually an interesting tool from a public health perspective, but it does have its limitations on narrowing it down to specific neighborhoods or even regions.
Thank you. That concludes the list of questions that have been received by the task force prior to and during today's briefing. As Dr. Garza noted, the task force will provide updates to the media via press release for the duration of the week, and the next scheduled live stream will take place next Tuesday. Thank you for tuning in.